Hi, it's Dr. Tracy Papa. Welcome back to the channel. If you like the content that you're seeing and want to be the first to know when something new comes out, subscribe to the channel and turn on your notifications. Today we're going to talk about trisomy 18. I did a post a while back with Kristen, whose baby Hannah had trisomy 18. And in the comments, I noticed a lot of conversation around how we diagnose this condition and what survival is like and what the quality of life is like for babies who have trisomy 18. So since there's such interest in this topic and I've got a lot to talk about with it, the next couple of posts are going to deal with how we diagnose trisomy 18, different ways to diagnose it, and also what life looks like and life expectancy looks like for babies who have trisomy 18. When we're talking about trisomy 18, what you need to know is, what is this condition? Most of us are born with 46 chromosomes, 23 from mom and 23 from dad. Some babies, though, are born with one extra chromosome. Babies who have Down syndrome are born with an extra 21st chromosome in every cell of their bodies. Babies who have trisomy 18 are born with an extra 18th chromosome. And depending on which chromosome is duplicated in your cells, it creates a very different picture. When I was training 20 years ago, trisomy 18 was considered a uniformly lethal condition. So when we delivered the diagnosis of trisomy 18 to parents who were expecting, more than half of them, I would probably say most of them, elected not to continue the pregnancy. Now what we know about trisomy 18 is that it's a life-limiting condition. Babies who have trisomy 18 have a limited life expectancy, but many parents are choosing not to terminate the pregnancy, but to continue the pregnancy and enjoy as much time with their affected baby as possible. So the next question is, how do we diagnose trisomy 18? How do you know if you're carrying a baby with trisomy 18? Many people who have a baby affected with trisomy 18 don't find out about this until after the baby comes. We do like to try to diagnose it prior to delivery if possible, to give you a better opportunity to prepare for the special problems that these babies are going to have. So when you are pregnant, you will usually be offered some kind of screening test for abnormal chromosomes. The most common chromosome abnormality is Down syndrome, but the second most common is trisomy 18. So many of the screening tests that we have include a screen for trisomy 18. For instance, the quad screen or penta screen is a blood test that looks at different proteins produced by the pregnancy, and depending on whether these values are higher or lower, your risk of having a baby affected with trisomy 18 or trisomy 21 goes up or down. Another screening test that's more accurate than the quad screen or the penta screen is NIPT, or non-invasive prenatal testing or screening, which is another screening tool, and it's a blood draw, so it's non-invasive for your baby, and it looks directly at fetal DNA in your circulation. So it has a very high accuracy or a sensitivity for detecting trisomy 13 and 18 and 21. But it's still just a screening test. So when you are thinking about having one of these tests, you need to be counseled properly about what the test will tell you and what it won't tell you. So some people will have this test and get a result back that indicates a high risk of having a baby with trisomy 18 when that is information that they may not have wanted. The only way to diagnose trisomy 18 definitively prior to delivery is with looking at the baby's chromosomes directly with either CVS or chorionic villus sampling, which can be performed earlier in pregnancy, or more commonly amniocentesis, where we take a needle and put it into the amniotic sac around the baby, take out a little fluid with fetal cells floating in it, and actually culture the fetal cells. This will give us a definitive diagnosis, a definite yes or no about whether your baby has trisomy 18 or another chromosome or genetic condition. What you need to know about amniocentesis is that it is an invasive procedure. So that means there's a small chance of having a complication with amnio that might lead to a pregnancy loss or an early delivery. The complication rate in experienced hands, for instance, if you go to a maternal fetal medicine office where we perform amnios just about every day, the risk of having a complication is less than 1%. It's more like 1 in 300 to 500. Complications, when they happen, include ruptured membranes because we're poking a hole into the sac around the baby, and sometimes fluid can leak out of that hole. The second complication that's more common is infection. So we try to be really careful about sterile technique when we're doing your amnio, but there's a small possibility that bacteria could be introduced into the amniotic sac around the baby, and after a few days you might develop a fever or an infection inside the uterus, and the only treatment for that is to deliver the baby. So those are the two most common complications, but the sum total of complications is still less than 1%. So I see a lot of people start shaking their heads even when I'm describing an amniocentesis, and they just say no right away. But it's a good test if you want the most information about your baby. So it's not for everyone. Some people tell us after an abnormal screen, I don't want the amniocentesis, I'm going to continue the pregnancy no matter what, I'm going to love my baby no matter what I have. So the reason most people get amniocentesis is to have that definite yes or no, so that they can move on and begin to prepare and find out as much information as they can about what it's like to have a baby with trisomy 18. One question I'm asked pretty frequently is, well, my ultrasound looks just fine. How can my baby have a chromosome abnormality? Or everything's fine, right? Because the ultrasound looks good. Well, ultrasound, a normal ultrasound, can certainly reduce your risk of having a baby with a chromosome abnormality, but it doesn't eliminate it. So there are babies who have Down syndrome, for instance, and also trisomy 18 that may not have any abnormalities that we can see on ultrasound, especially if you have your normal screening ultrasound at about 18 to 20 weeks. Babies who have trisomy 18 frequently have birth defects and subtle findings. They may grow, their growth may lag behind a little bit. They may have low set ears. They may have clenched fingers or fingers that overlap a little bit and don't open and close normally. Sometimes they can have clubbed feet or feet that turn in. Sometimes they can have birth defects like extra fluid in the head or open spine defects. But lots of babies who have trisomy 18 don't really have any visible birth defects, especially when you have your 20-week screening ultrasound. As the pregnancy progresses and you get closer to your due date, sometimes it becomes a little more evident that there's something going on because babies who have trisomy 18 may not have very good muscle tone, so they may not swallow amniotic fluid like normal or typical babies do, and so amniotic fluid tends to build up. And one of the signs that we can see on ultrasound is a lot of extra fluid around the baby. Sometimes, like I said, they'll lag behind in growth, or sometimes a heart abnormality that may not have been detected at your earlier screening may become more obvious later in the pregnancy. So a normal ultrasound is always great, but you can't count on that normal ultrasound to rule out genetic or chromosome abnormalities. So that pretty much sums up screening and testing for trisomy 18. Many people choose to not be tested at all, and that's perfectly reasonable. I always tell people, just because we have a test doesn't mean you need to have it. So it's really important to talk through, well, what are you going to do if your test comes back abnormal? And if the answer is, I'm not going to do anything except worry for the next 6 months, maybe that test is not for you. So do be sure and talk through this with your provider. Thanks for watching. If you want to know more about trisomy 18, don't forget to subscribe to the channel and turn on your notifications, because in the next episode we're going to talk about something that parents always ask me when they're carrying a baby with trisomy 18. Will my baby survive? What is the life expectancy for trisomy 18, also known as Edwards syndrome? What is the quality of life going to be like for my baby, and what can I expect? We're going to dive a little deeper into all of those questions in the next episode. Stay tuned.